the excretion, now the drug has absorbed, this is distributed and metabolized, and the last portion in case of this particular drug phase path is excretion. Means excretion is a process in which the drug get out of the body through kidney or any other organ of the body. So here the routes of the drug excretion, the major routes are, one of the important route of the excretion is kidney or renal excretion. The second is the biliary and biliary excretion. Third one is the fecal, and apart from this one, alveolar pathway. So lung is also an excretory organ. Please remember that kidney, liver and lungs are important organs of excretion, whereas the minor routes of the excretion are skin, saliva, sweat, hair and milk. So these are also the other routes of drug administration, but these will not play important role. But you have to remember all these things, major and minor routes of the elimination. So the drug, whenever when any drug or drug is a foreign body, or then when it's getting inside the body through the absorption process, then it is to undergo the metabolism process, maybe phase 1 reaction or phase 2 reaction, or among the phase 1 oxidation, reduction, hydrolysis, and phase 2 the conjugation, glucuronide conjugation, acetylation, methylation, and so many. Ultimately, it will be converted to a polar or water soluble metabolite and get excreted out of the body. That's how it undergoes, and it is excreted out of the body by the kidneys. That's the number one organ of excretion, whereas the number one organ of the metabolism is liver. Then apart from this one, liver acts as both the excretory organ as well as the metabolism organ. And the fecal route is also another route through which the drug get excreted. And many of the drugs, the alcohol, etc., they are going to be excreted through alveolar route. And apart from through sweat, the drug get excreted through skin, and also saliva. Salivary excretion is also present, sweat, then hair and milk. So these are the organs of excretion. And here you can see that the drug excretion is mainly through kidneys. Then through the kidneys means through the urine only, because in the kidneys the urine is formed. Then the lipophilic drugs are then once again they are not excreted through the urine. Then they get what you call as reabsorbed in the kidney, get circulations and made as the hydrophilic drugs. So after a lot of process, this is made as hydrophilic drugs. Then if they are hydrophilic, then the kidneys will handle them and it is excreted through urine. Suppose it is not possible, then what happens? It is going to be secreted in the feces, and sometimes it is reabsorbed into the liver once again. Once again this pathway undergoes. Whereas the other organs like the lungs and the milk, through milk also many of the drugs are excreted, especially some of the antibiotics are excreted, and this is taken for the therapeutic activity or for treating the mastitis. Suppose chloramphenicol is the drug, it is one of the classical drug which is recommended for the treatment of mastitis, because its high quantity is secreted in milk, and the minimal inhibitory concentration is attained in the milk, so that it can kill the microorganisms. So why we have to study all these processes is to have the efficient treatment of a disease. Suppose we are having certain infection of the lung, then we should choose such a drug that its concentration is reached to the maximum extent in lungs. Suppose you want to treat a dermatitis case in dogs or in the cattle, the drug should act, or its concentration should be maximum in the skin. Whereas if you want to treat a urinary tract infection, then its concentration, the drug should be more and more excreted unchanged in the urine, just like the what you call as the fluoroquinolones. And so sometimes if you want to treat the oral cavity, then the drug oral cavity infections or something like that, then it should be excreted through saliva. Then the first and foremost important excretion process is through renal excretion. Renal excretion. The kidney is responsible for excreting all water soluble substances. Once again, all the water soluble substances are excreted through kidney. The amount of the drug or its metabolites ultimately present in urine is the sum of total of the glomerular filtration, tubular reabsorption and tubular secretion. So here first the drug will get absorbed into the circulation, then it will get metabolized, and during this process only absorption and distribution and metabolism only, the several times it circulates through the glomerular or through the kidney. Then usually because of the hydrostatic pressure, the glomerular filtration occurs. Then after this thing, once again, if the drug is not made more lipophilic, it is getting reabsorbed into the circulation. And the third one is the tubular secretion. So these three are important processes for the excretion. So the important media through which the excretion occurs is the urine, and it is most important channel of excretion of most of the drugs. Means many of the drugs do undergo the yeah, it is the most important channel for excretion of most of the drugs. And so kidney, it's one of the common for majority of the drugs for the excretion is concerned, and most of the time kidney excretes water soluble substances only. The fat soluble or lipophilic drugs are not excreted through kidney directly. Once they get what you call as more and more lipophilic in nature, then they get excreted through kidney. And renal excretion determined by three phases. The number one is the glomerular filtration, tubular reabsorption and tubular secretion. These are all the three processes, important processes. So net renal excretion. So ultimately how the urine is formed is glomerular filtration plus tubular secretion. See, both of these processes are making the drug out of the body, whereas the tubular reabsorption is getting the drug once again inside the body. So the net renal excretion is equal to glomerular filtration plus tubular secretion less or minus tubular reabsorption. That's the thing. Suppose it's a hydrophilic drug, then the tubular reabsorption is almost zero. Then the net renal excretion is perfect, or glomerular filtration plus tubular secretion makes the drug out of the body. Suppose the drug is lipophilic, then most of the drug is getting reabsorbed into the circulation, whereas then the excretion decreases depending upon if the tubular secretion reabsorption is more and more, then the renal excretion is less and less. So they are inversely proportional. And here also we can see that in the, suppose this is a kidney tubule, both usually the kidney is supplied with both afferent and efferent, means the both the veins and the arteries, the kidney is supplied. So usually the drug is entering the body, then it's if it is a highly lipophilic in nature, what happens is it is getting 99% is getting reabsorbed into the circulation. Whereas the drug, if it is getting combination with the many of the other substances made hydrophilic, then it is going to be excreted through kidney. And the important process here is glomerular filtration. Glomerular filtration. That's the first process through which the kidneys or get out of the drugs. Glomerulus capillaries have large pores. Usually the glomerular capillaries, you know the structure and other thing in physiology you might have learned. They have got more and more bigger pores. So all free drugs, lipid soluble or insoluble, are filtered through it. So either hydrophilic or lipophilic, it doesn't matter. The drugs get excreted through the glomerular filtration. So the glomerular filtration depend upon the molecular size. Bigger and bigger molecules cannot be excreted, whereas when they are made smaller, then they get excreted out of the body. Then the first one is the molecular size, then the plasma protein binding, and the renal blood flow. So plasma protein binding, many of the lipophilic drugs will have the plasma protein binding ranging from 50 to 100%. So then the quantity of the blood that is going to be circulated through the renal artery is also very important. Normal glomerular filtration rate or GFR is 120 ml of the blood per minute. Means, so in a hour, what you call as the 120 ml, this you have to remember, the glomerular filtration rate ranges from 100 to 150 ml per minute in a single glomeruli. This 120 ml is undergoing. So such a big quantity is usually circulated through the kidneys. And the glomerular capillaries have pores, they are bigger in size than the usual all non-protein bound drug, whether lipid soluble or insoluble, presented to the glomeruli. They get filtered because the pore size is more here, whether it's a hydrophilic or non-hydrophilic, protein bound, non-protein bound drugs. They get access to the glomerular capillaries and get excreted out of the body. Thus, glomerular filtration of a drug depends on its plasma protein binding and renal blood flow. More and more blood flow exposes the drugs to glomeruli. Hence, more and more drug getting excreted.